Good morning, everyone. In today's lecture, we will explore how patient satisfaction is shaped in sexual and reproductive health SRH services. We will also examine how internal marketing, meaning how staff are trained, motivated, and supported, directly influences satisfaction. To guide us, we will move in three steps. First, how patients experience care. Second, how providers' behavior shapes those experiences. And finally, how organizational culture ties everything together. Let's start with the foundations of patient satisfaction in SRH. SRH care deals with very personal areas: family planning, fertility, STI treatment, and pregnancy options. Because these topics are intimate, patients primarily evaluate services based on how they are treated as individuals, rather than just on medical competence. Example, a patient seeking contraception values confidentiality and respectful communication as much as the clinical procedure itself. Research consistently shows that service quality significantly affects satisfaction, encompassing waiting times, clarity of communication, cleanliness, staff professionalism, and follow-up care. Satisfaction acts as a mediator between internal marketing and the overall patient experience. Internal marketing improves staff behavior and teamwork. Better staff behavior increases patient satisfaction. Higher satisfaction improves the overall experience. Think of it as a chain reaction. A strong internal environment ensures patients feel valued even before care begins. Example, even a simple, seamless handover between nurses reassures patients that the facility is organized and trustworthy. Having seen satisfaction at the surface level, it's essential to understand the role of communication, which brings us to the next slide. In SRH, sensitivity and confidentiality are critical because of stigma, cultural taboos, and privacy concerns. Discussing infertility, STI testing, or pregnancy options can be emotionally heavy, so patients need assurance that their information is handled discreetly. Effective communication includes clear explanations, avoid jargon when explaining contraceptives or treatments, empathy, acknowledge patient anxiety or fear, such as before an HIV test, and non-judgmental tone. Ensure patients feel accepted regardless of age, marital status, or circumstance. Strong communication protects reproductive autonomy, allowing patients to make informed choices freely, such as selecting a contraceptive method that fits their lifestyle rather than being directed by the provider. Now that we understand the importance of communication, we can examine the next layer, the role of staff engagement. Engaged staff are more likely to uphold confidentiality, especially in stigmatized areas like STIs, infertility, abortion care, or sexual dysfunction. Deliver respectful, person-centered care, adjusting their approach to each individual. Manage sensitive encounters without bias, respecting diverse religions, sexual orientations, and reproductive histories. Conversely, a poor internal culture, characterized by overworked, undertrained, or unsupported staff, leads to negative patient experiences, rushed consultations, and decreased utilization of SRH services. Now that we understand how staff engagement influences patient experiences, let's examine how provider behavior impacts autonomy and satisfaction. Provider behavior has a direct impact on birth experiences, respectful communication, dignity, and freedom from coercion during maternity care. Contraceptive decision-making autonomy. Supportive providers present options, coercive providers pressure patients. And willingness to return for follow-up care. Positive interactions encourage continued engagement with SRH services. Internal marketing improves provider behavior by encouraging teamwork, recognizing staff, and providing ongoing training. This demonstrates how internal marketing influences service quality, as a strong internal culture is linked to higher patient satisfaction. With this foundation in place, it's essential to define internal marketing clearly. Internal marketing involves training, motivation, and shared values. It strengthens provider communication and fosters a supportive, aligned work culture. Example, role-play sessions on discussing contraception with adolescents can dramatically improve communication quality. By building motivation and shared understanding, internal marketing reduces burnout and ensures consistent, respectful care. Next, we'll see how internal marketing directly drives SRH service quality. Internal marketing influences service quality through internal communication, ensures consistent messages are delivered to patients, employee motivation, leads to attentive, empathetic care, and organizational culture, promotes a respectful, stigma-free environment, crucial in SRH for adolescents, LGBTQ+ clients, or people seeking STI treatment. Although one study showed adverse effects, most evidence indicates that internal marketing has a substantial positive impact on service quality. Because SRH care is emotional, private, and rights-based, internal marketing is essential, it is not optional. Now, let's integrate these insights into a complete picture of patient satisfaction. To bring everything together, think of internal marketing as the engine that drives patient satisfaction in SRH services. When staff are well-trained, motivated, and aligned around shared values, it sets off a positive chain reaction. Improved teamwork. Staff members coordinate seamlessly, support one another, and communicate effectively. Better communication with patients. Consistent, transparent, empathetic messages reduce confusion and build trust. More respectful, person-centered care. Patients feel heard, valued, and safe. Enhanced SRH patient experience. Satisfaction increases, encouraging patients to return and follow recommendations. Here, satisfaction acts as a mediator. A patient who feels respected and informed perceives care as high quality. Their positive experience strengthens trust in the facility and reinforces the facility's reputation in the community. In SRH, trust, choice, and respect are core determinants of outcomes. Patients are more likely to choose safe methods and follow treatment plans. They are more willing to return for follow-up care, ensuring continuity. Internal marketing indirectly protects reproductive rights and improves overall health outcomes. In short, investing in internal marketing doesn't just benefit staff, but transforms the entire patient experience, making SRH services more effective, ethical, and patient-centered.